Hello everyone, welcome to you this ISF College of Pharmacy free online lecture series as per B.Pharm syllabus, strict compliance of Bachelor's of Pharmacy syllabus as per Pharmacy Council of India syllabus. Myself, Dr. SOURABH KOSEY, working as Head and Professor, Department of Pharmacy Practice, ISF College of Pharmacy. We are here today to tell you 8th semester students about third unit first topic HIV and AIDS, which is specifically in concern with the subject social and preventive pharmacy. So before starting my session, I would like to emphasize brief about this ISF College of Pharmacy, which is a NAC-A accredited college, which is located into GT Road, Galkala, Moga, Punjab. It's affiliated to IKJ University, Jalandhar, and college is NAC-A, as I earlier told, autonomous status by University Grants Commission and NIRF 29th rank in 2021. It is approved by AICT, PCI and Government of India and recognized by UGC under the section of 2F and running all the pharmacy possible programs, D-Pharm, B-Pharm, M-Pharm in 9 branches, that is toxicology, chemistry, analysis, QA, cognosy, pharmacy practice, industrial pharmacy, and regulatory affairs. And we do have also doctorate programs, and PharmD is also one of PG programs, as well as PharmD post-baccalaureate. And to addition in practice domain, we do have B-Pharm practice, as well as about the proportion of lateral entry. After diploma, we have B.Pharm lead lateral entry too. And we have CDS co-NABL approved accredited lab, analytical lab, where do industry comes for product sampling, drug testing laboratory, where cosmeceuticals, pharmaceuticals, and veterinary, food, soil, etc. products do come for the testing. And there are various positions like NIRF, NAC, autonomous, Atal Innovation, and many more. And we are 38, 39-year-old institution with almost 800 papers have been published with 3922 paper in Scopus, 141 in Web Sciences, citation of more than 6,000 and more than 1,000 total impact factor, I index, 80 and edge index, 45 with 11 technology transfer, around 3 dozens of patents, and successfully completed 25 government funded projects. So this was the brief about the college. So I would like to thank the ISF College of Pharmacy, Professor G.D. Gupta, Director cum Principal, and the coordinator of this online series, Engineer Parneet Kumarji, IT cell head, who is tackling this YouTube live session for dear students. So thank you, Praneet. Moving towards the today's topic called social and prophylaxis of HIV and AIDS, where there is a social stigma of this segment that like what this HIV or AIDS is. So we talk about the fact files of this HIV. So as you know that human immunodeficiency virus or acquired immune deficiency syndrome, which was related to the immunity, and particularly on 1st December 1988, this day was observed by all United Nations state members, and the frequency of this World AIDS Day is to observe this. The disease is 1st December every year. So the symptoms is lymphadenopathy, which is enlargement, swelling in the lymph nodes, headache, difficulty concentrating, skin rashes, fever, night sweats, respiratory system, dry cough, pneumonia, sore throat, digestive system, nausea, vomiting, diarrhea, muscle pain, nail thickening and curving, joint pains, weight loss, and fatigue, etc. What is HIV? HIV is human immunodeficiency virus, which spreads through bodily fluids that affect all kind of specific cells of the immune systems, which is called as CD4 cells or the T cells. And this HIV kills the body CD4 cells, which is called T cells, and damages the immune system. So this HIV replicates inside the body, human body. It must invade a healthy cell into body to survive. Whereas uncontrolled, we can say, damage to the immune system is there, and due to it, there is a major problem which is concerned with this HIV. So basically, it is of two types, one and two. So AIDS is specifically a late stage, you can say, of HIV infection, which is once diagnosed, the body has hard time fighting disease, and certain kind of other malignancies and disorders do take place, such as cancer. And in this specific part, the diagnosis is sure, but there is no sure treatment. So, specifically speaking, for the diagnosis of this one, you have to see the positive HIV testing, and into this segmented very low CD4 count, or more than 200, would say that cell count is more less than 200, and particularly presence of a specific cancer or infections may be there. And moreover, in this section, the presence of generalized terminology which looks for this specific cancer, we have to see. Furthermore, all over we have to see that the very low CD4 count leads to this stigma. So in this stigma or the infection part, what is the concern? We have to see that preventive action or the prophylaxis, so called as uh, prevention is cure. So in this segmented workflow, this strategies work over here. Okay. So moving towards the next slide of this HIV diagnosis, what we have to see that we know that there is no cure. Meanwhile, we do give certain antiviral medicines or agents, antiretroviral medicines or immunosuppressants. So what I believe firmly that HIV patient specifically, there is a social stigma which is not told into the community or the society or to the mass or to the population. So as you know that this is the last stage of HIV infection. Once it is diagnosed, the body doesn't find it much suitable for the living. So like there are basically four stages of uh, this HIV infection. In the very primary stages, like flu-like symptoms, which will be there, which will be occurring from day 1 to day 45, say 1 to 6 weeks after there is an infection which have been entrant into the body, and there is no symptom, and this infected person can infect other peoples or persons in the society as well. So this stage is called as the primary one, from day 1 to day 45. Whereas the stage 2 is called as asymptomatic, where the symptoms doesn't arise. You are not that much able to see the symptoms, but you comes up with the part that yes, with the certain time follow-up time going up, stages of free from symptoms, but there is a lymph enlargement, swollen glands, and the level of the HIV virus in the blood drops at specific time at very low levels. So the HIV antibodies are detectable into the blood specifically. Third stage which comes up is a symptomatic one, where the symptoms are mild, the immune system deteriorates, and the emergence of opportunistic infections such as cancers, there are chances that this may occur. And after this symptomatic stage, like person may find at the last stage, and there are some lesions on the skin, which is called as scaposis, lessens, which the immune system weakens, and the illness become more severe, leading to an AIDS diagnosis. So, coming to the this HIV AIDS segmented part, HIV is found in body fluids such as semen, breast milk, blood, vaginal fluid. So semen is called as in Hindi veer, breast milk is called as istan doodh, blood is called as rakt, vaginal fluid is called as yoni taral padarth. So you see, it is transmitted or communicated, infected from the one part of the body to other via certain kind of fluids or liquids. So coming to the next, moving to the next part, this HIV infection is passed on. It may be of varying capacity. It may be due to the unprotected sexual intercourse via anal, vaginal, or oral. And when there is a contact with HIV infected blood or blood products, specifically when you are sharing any IV drug needles of positive people. So medicated, once a needle is used, and if it is used and the people are positive, HIV positive, so cross contamination or the chances of this HIV positive infection is more tremendous. And particularly at from mother to child, there are chances, yes, specifically there are chances from HIV positive mother to the small kids or the children, this infection may lead. And also during the lactating or the nursing mother, after the pregnancy, in the lactation period, during the breastfeeding, there is a chance. So question arises, what is AIDS? So as we come with the acquired immunodeficiency syndrome expansion of the word AIDS, so acquired means to come into possession of something new, to get acquired. Immune deficiency means your immune system is deficient, which decreases or weakens the body ability to fight off any kind of infection or disorder, disease, or illnesses. And the syndrome, which you know that it's a group of signs and symptoms that may occur together or characterize a particular abnormality. So, as this subject is not moreover much concerns with the one part of how the HIV is spreaded, but this part is specifically like we need to see that concern part transmission, how this takes place. So the HIV infection is passed from person to person through bodily fluid, or you may say that specifically this is passed or is spread with the unprotected sex, or certainly people who are living with we can say slum region or the red light area, or in the prostitution they are involved, or the unprotected sex with people living with HIV. It may be vaginal, oral, anal, and the blood to blood contact, exposure to HIV before or during birth or through at the breastfeeding time. So certainly there is a chance that this HIV infection may transmit. So how it is transmitted? In the public, like razor blades, blood to bloods, knives at the barber shop, needles, syringes, medical, if somebody is doing medical drugs, needles or needles for used for the purpose of skin tattoo nowadays, darkening of gums, or unprotected sexual intercourse with the infected partner, exposure of broken skin wound, infected blood or bodily fluids, transfusion with HIV infected blood, injection with contaminated objects, mother to child during pregnancy, breastfeeding. So the modes of transmission, specifically unprotected sex during from birth time, blood transfusion, sharing needles without sterilization, or increasing the chances of contracting HIV. So this needles are specifically one of the reason which are responsible for this process. You can see that needles, once it is used for the medical drugs or the abused person, there is a chance that this will contract the HIV, human immunodeficiency virus. And another segmented part is with when you have the intercourse, where the penile penetration into the vagina, the intercourse is done orally. Digital sex, uh, which are nowadays famous with couples. So digital sex on the mobile phones, or unnatural anal or oral. So certain kind of types of sex which are responsible specifically for having this HIV infection. So HIV, specifically this social stigma, has to be cross barriered of, and a public or a human library communication is required to break the bias and this kind of people shyness to tell them what is exactly right or wrong. So nowadays, this is one of the topic of matter that which do relax do happens in the society. Mother to the small baby before birth or during birth or postpartum or after the birth, this takes place. So this is one of the problem from mother to baby which has to be held up. Testing options for HIV, the options which comes with the testing as per the National AIDS Control Organization NACO in India. No name is used, unique identify number, research, the results which come, either it comes negative or the positive. The confidentiality is highly maintained and it is given to the recipient only. Confidential testing which comes up personal name is recorded along with the HIV results. Name positive results are reported to the State Department and Center for Disease Control and Prevention, and result issues only to the test participants. Now, what is the diagnosis of this? The blood detection test, which can be comes up with the ELISA, enzyme linked immunosorbent assay, enzyme immunoassay, EIA, or radio immunoprecipitation assay, indirect fluorescent antibody assay, IFA, polymerase chain reaction, Western blot confirmatory test, etc. has to be done to finalize the diagnosis of HIV/AIDS. Urine testing has to be done, whereas in the urine testing, Western blot technique, urine Western blot technique is used as sensitive as testing blood. Safe way to screen for HIV, which can cause false positives into certain people at high risk for HIV. So this is one of the problem. Then oral testing, OraSure is one of the product which has been approved by HIV as an antibody, which shows the accurate kind of blood testing, which draws blood-derived fluids from the gum tissue, and it is not a saliva test. Next, which comes is as a counseling, and in the counseling, patient counseling part, which we have to see is the pre-test counseling. So primarily, I need to do the counseling and transmission, how the transmission, mode of transmission, prophylactic concern or the preventive measures, risk factors, what are the various risk factors, voluntarily, and the confidentiality part has to be done to outweigh the social stigma, social risk, and specifically this concern part has to be seen. So reporting of positive test results and the way. Post-test counseling, we need to clarify the test results, need for additional kind of testing, promotion of say, behavior, release of the results, specifically how results you give by post, And now it's come on the part of the treatment sort of options. Antiretroviral drugs like nucleoside reverse transcriptase inhibitors, zidovudine, non-nucleoside transcriptase inhibitors, varamine, protease inhibitors, Norway, ritonavir, etc. is available. Opportunistic infections are there where we need to issue an event when antiretroviral drugs are not available. Now the next part which comes up where to protect yourself is abstinence. It means keeping a safe distance, and the person is being sexually keeping and maintaining a distance. And certainly the second part comes up is the monogamous relationship. एकल संबंध कहते हैं हिंदी में जिसे you should have only partner to have this sexual intercourse. Multiple partners lead to have the problem. At the third proportionate portion which comes up is the protected sex, means the surakshit sambhog. And the fourth part is the sterile needle has to be used for the medical purposes, means always nowadays disposable syringes are widely used since last 3 decades. So sterile needles has to be used. Abstinence, it is the only 100% effective method of not acquiring HIV/AIDS, and which are refraining from sexual contact, which is oral, anal, or vaginal, and refraining from intravenous drug use. So certainly kind of medical pleasure or medical drugs should not show that kind of limited workflow. Monogamous relationship is called as a mutually monogamous, only one sex partner relationship with a person who is not infected with HIV. So HIV testing before intercourse is necessary to improve your partner is not infected. Protected sex, where condoms, male or female, both are available in the market. Every time you have to wear it before sexual or physical intercourse, whether it is vaginal or anal. Use latex or polyurethane condom, not a natural skin condom. Always use the latex barrier during oral sex. When using a condom, there are several things which social talk, a preventive measure must come up, that make sure the package is not expired of this method. Make sure to check the packages are not torn or cutted or damaged. Do not open the package with your teeth for risk of any kind of tearing. And never use the condom more than once. Use water-based rather than oil-based condom. And sterile needles, if a needle or a syringe or cooker is shared, it must be disinfected. Fill the syringe with undiluted bleach and wait at least 30 seconds. Thoroughly rinse the water. Do this process between each person's use. Needle exchange program with non-profit organizations which provide sterile needle in exchange for the contaminated ones. Whereas for female condoms worn inside the vagina or anus, which are thicker, more tear resistant, always use latex free, wider opening covers more pelvic area, Dental dams used for oral sex could make your own dental dam. There is a period called as the window period when a person gets infected. It may take more than 6 weeks or up to 3 months before antibodies to HIV are detected in the blood. So the HIV test looks for antibodies. When these antibodies are detected, the person is diagnosed HIV positive. So a person can be positive and the test shows negative because the test was done during the window period. So opportunistic infections associated with AIDS is bacterial, tuberculosis, streptococcus pneumonia, parasitic, pneumocystic carinii, fungal, candida, cryptococcus, viral is Kaposi sarcoma, herpes, influenza, powder flow. So there are certain kind of you see as a syndrome where the bacterial, parasitic, fungal, viral infection both at a point comes to a specific syndrome called AIDS. So as you know, it is transmitted to vaginal sex, anal sex, oral sex, multiple sex partners. So that's why monogamous relationship is must. Sterile needle, pregnancy, breastfeeding, blood transfusion, or when certainly bitten up, so blood to blood transmission, organ transplantation, or the wound contacts, or the deep kissing, occupational exposure. So HIV can be transmitted by sexual transmission, transmission by blood or blood products, occupational transmission, maternal, fetal, or the infant transmission. Top 5 myths about the HIV that you cannot contract with HIV: sharing items like cutlery, cups, dishes, towels. So it's not possible to live with a normal life with. So it is a myth, not a fact. Okay, so you can share uh, lunch, dinner, seats with them. So it is not a kind of thing which is spread person to person, and specifically you cannot certainly say that HIV can be transmitted, risking, and individuals who use drugs can only get HIV if they share needles or syringes. So that is also wrong. Okay, so infected needles are the one of the primary sources. Then women who are infected with HIV or AIDS cannot have children without passing on the virus. So this is a myth. So it is not transmitted by shaking hands or hugging or dry kissing or sneezing, coughing, mosquito bite, toilet sharing, sharing of telephone, sharing of offices, traveling together in buses, trains, sharing cups or cutlery, living in same room, donating blood aspectically. So World Health Organization has also given one app called as WHO STS Info HIV testing services. This info makes it easy view to WHO guidelines, guidance on HIV diagnosis and testing on smartphones and tablets, online or offline, way everywhere. So AIDS counseling is foremost part where HIV/AIDS counseling is an active process of communication and dialogue between a trained counselor and a client who represents presents with problems related to HIV/AIDS and an view to assist the client to deal with these problems adequately and appropriately. So prevention: use a condom every time. So you need to pitch it, leave an inch, and you need to now then roll it. So this is the prevention and the treatment part. We need to talk with the partner about HIV. Use the condom with your regular, non-regular clients, partners every time you have sex. Reduce the number of main partners. If monogamous relationship is one of the key segmented, I would say that preventive part or prophylactic part to safeguard the HIV, and get tested, know your status, and anybody having sex without a condom, people with more than one partner who don't use a condom during sex, people whose sex partner have sex with their other partners without using a condom. You cannot get a HIV by hugging, touching, living, or caring for someone with HIV, shaking hands, or kissing. You cannot get HIV from eating out of the same plate or cup or utensils that an HIV positive person uses. So these are the references, and if any queries are there, you may ask the certainly question. If any question is there, I am more than happy to answer it. So I'm not watching any kind of question on the YouTube chat live. So thank you so much for your patience listening.